as I was saying, the environment for an intervention with type 2 diabetics would have to be fun and engaging and motivational. And this may look like possibly having personal trainers who are enthusiastic, or just even a fun environment, or motivational posters or challenges being put to, people that you're engaging in physical activity, just to keep them involved and to keep them motivated. A third factor for the setting is that it be safe, and this not only pertains to general well-being and safety that anyone would hope for when they're being physically active, as far as it being, indoors as opposed to outdoors, well lit, supervised space, but specifically for type 2 diabetics, this means having specially trained staff on hand to treat any disease-related pain, and in particular to treat low blood sugars, which I discussed before, so that hypoglycemia can be very dangerous and very scary. And so, in addition to having people on hand who know how to treat hypoglycemia, also just having appropriate foods on hand, so fast digesting carbohydrates, things like simple sugars, bananas, even just straight glucose tablets for people to take. Ideally, we would like any physical activity facility to be affordable. I think that's something that everybody can back, not just type 2 diabetics. And then finally, there needs to be various options for physical activity. Cardio is shown to help with a lot of complications with type 2 diabetes, including circulation, weight loss. But it's also very difficult for diabetics who are heavy or have a lot of pain, as we talked about in the barriers section. And so weight training and resistance training has also been shown to help with insulin and glucose level management, weight loss, calorie burning. So all the things that may not be available options to people who may be carrying extra weight. And in addition to that, having activities that require minimal impact on joints, such as recumbent bikes or swimming pools, would be appropriate for that setting. Some final considerations for this group are, again, psychosocial factors that could affect anyone may be more pressing for someone with a chronic disease, especially because type 2 diabetics are typically stigmatized. They're seen as bringing the disease upon themselves. They could be seen as lazy or gluttonous if they're overweight, and that certainly wouldn't inspire anyone to get physically active. So these are things to bear in mind with this population. In that same vein, considering the effects that stress can have on insulin sensitivity versus the effects that exercise have. So basically, what this means is just that stress causes reactions in our body that lead our body to resist taking in any nutrients, including sugars, into the cells. So they just stay in the blood, and we end up with very high blood sugar levels, which is exactly what type 2 diabetic does not need. Exercising, on the other hand, actually helps with insulin sensitivity so that our cells will take it in and use it, and the sugar doesn't stay in our blood, which is what they do want. So this is something that needs to be balanced as well, so there needs to be appropriate stress management mechanisms in place in an intervention for this group. And then finally, just a watch out with this group that some symptoms of diabetes, usually with people who don't know that they have diabetes, can overlap and mimic those things that we experience with physical activity, such as increased thirst, increased hunger, fatigue, and weight loss. So someone who is actually starting to be physically active and also experiencing these symptoms may think that they're just doing all the right things with their fitness and their physical activity, and may actually be experiencing the early symptoms of diabetes. So again, these are just some considerations and implications to think through before starting physical activity with type 2 diabetics. Please let me know if you have any questions. You can put them on Blackboard and I will respond as soon as I see them and get a chance to do that. Yeah, thank you very much. You can see my references here and here. I look forward to your questions. Thank you.